Welcome to Mind Your Brain Health presentation hosted by the Dementia Society of Ottawa and Renfrew County and Ottawa Public Health. My name is Herman Chica Alfonso and I'm the Education and Program Coordinator for the Dementia Society. I'm delighted to be here today and thank you to the First Unitarian Congregation of Ottawa for inviting me to be your speaker and host. Thank you for watching this video, and hopefully this information will be really useful and you can start being brain healthy. The first question is why we should talk about our brain health today. So our brain does an important and complex work. It's the CEO of the body, it's the headquarter, it's the manager. So we need to take care of our brain as the rest of the body. And now we have more evidence that we can do things to improve our brain health and prevent dementia. Just recently, the Lancet Commission on Prevention and Care, Dementia Prevention and Care, published a paper that tells that targeting 12 modifiable risk factors during life, we can prevent dementia and delay dementia up to 40%. So we can do things to improve our brain health. There's not an age to become brain healthy. There's not an age to start being brain healthy. We can start right now. Today, we're going to be talking about brain healthy choices. So I'm going to introduce you to 8 brain healthy choices that you can start following today. Then we're going to move into aging brain. And finally, we're going to talk about dementia, Alzheimer's disease. And at the very end of the presentation, I will introduce you to some virtual programs that we offer, the Dementia Society of Ottawa and Renfrew County, and how you can stay connected with us, and how you can break isolation. First of all, as I mentioned, we're going to start with brain healthy choices. We have 8 brain healthy choices that I'm going to be introducing to you. So number 1, care for your heart. Number 2, be active. Number 3, eat healthy. Number 4, be social. Number 5, challenge your brain. Number 6, protect your head. Number 7, sleep well. And number 8, care for your mental health. So these are 8 brain healthy choices that you can start following and become brain healthy and prevent dementia. Number 1, care for your heart. What is good for the heart is good for the brain. If we take care of the heart, it's the organ that will pump all this blood to the brain and the oxygen to the brain. So taking care of the heart is beneficial for the brain. We can start having regular health checks. Know your numbers, blood pressure, cholesterol, blood sugar, weight. Take care of your blood pressure. Quit smoking and limit alcohol intake. Number 1, care for your heart. What is good for the heart is good for the brain. Number 2, be active. Exercise. Research shows that exercising is beneficial for the brain as well. When we exercise, our heart beats harder and stronger. Our blood flow increases too to the brain. So aim at least 30 minutes most of the day, move more and sit less, and move to your abilities. Talk to your doctor if you're joining a new program, exercise program, and is that the right exercise program for you? But most importantly, stay active, be active, and aim 30 minutes most days. Number 2, be active and start preventing dementia. Number 3, eat healthy. Follow Canada's food guide. Have plenty of vegetables and fruits. Make water your drink of choice. In terms of proteins, it's important to eat fish, omega-3, and less red meat and fatty acids. The best healthy or the healthier diet to prevent dementia seems to be Mediterranean diet. It's high in omega-3, high in fish and vegetables and fruits and olive oil. So number 3, eat healthy. Follow Canada's food guide. Number 4, be social. It's very important for the brain to be social. We need to be connected. I know it's a challenge these days, but stay connected with others. Join a club, catch up with your friends, family, neighbors. Call your neighbor. Join any church activity that they offer online, or you can also volunteer for the community. These days, it's very challenging to stay social, but physical distancing doesn't mean to be isolated. You can you can stay connected with others. These days, we have a lot of online programs offered by the Dementia Society, so you can stay connected and break isolation. So number 4, be social. For the brain, it's very important to be social and stay connected. Number 5, challenge your brain. Expose your brain to new things. Do more than one type of activity. This is something very personal. If you like to do puzzles, Sudoku, crosswords, read a book, try to learn a new language, dance. Do whatever you think is good for your brain and whatever you think is very interesting for you. But most importantly, expose your brain to new things. Number 5, challenge your brain. Number 6, protect your head. Wear a helmet if you're doing any sport, like, for example, biking. Wear a seatbelt, reduce your risk of falls. Wear the proper shoes. It's very important to protect your head. These days, we now know that head trauma could be a risk factor for dementia. So protect your head. Number 6, protect your head. Number 7, sleep well. When we sleep, it seems that we're clearing up all those waste and proteins that cause dementia and Alzheimer's disease. So we need a good sleep. So aim at least 7 to 8 hours of sleep every 24 hours period. Have a regular sleep routine. Try relaxation techniques. Do regular exercise, because if you exercise, your sleep will improve as well, your sleep pattern. Expose yourself to light during the day, and try to, for example, turn off your screens or your cell phone. Disconnect when you sleep. It's very important to sleep well, because when you sleep well as well, your memories are stored better. So number 7, sleep well, important for the brain. Number 8, and I know this is challenging these days, but take care of your mental health. Talk about your mental health. Build resilience. Practice all the other brain healthy choices you have, or I offer to you today. Because if you take care of your mental health, you're taking care of your brain health, and vice versa. So taking care of your mental health will be good, and taking care of your brain health will also be great for the brain. So take care of your mental health, number 8. And I know this is something challenging these days, but according to the City of Ottawa Public Health, we have a few recommendations in terms of taking care of our mental health. So you can also get this poster on the Ottawa Public Health website. So during this pandemic, the first thing recommended is to try to unplug from media and find a balance. Physical distancing does not mean being alone. So you can stay connected through technology, through virtual support, and you can stay connected, for example, with the Dementia Society. So you're not alone. You can ask for or request for help in the community. We have a lot of mental health resources these days. And we know it's not easy. We know it's okay not to be okay. And try to take care of your body. Stay active, do physical activity. You can also do mindfulness. Is very good for the mental health as well. So try to do something to be mindful or take care of your body as well. So number 8, take care of your mental health. Is very important these days. Very important. What can I do now? So I know the brain healthy choices. Now you can make a difference. So number 1, repeat after me. Take care for your heart. Take care of your heart. Number 2, stay active. Number 3, eat healthy. Number 4, be social. Number 5, challenge your brain. Number 6, protect your head. Number 7, sleep well. And number 8, take care for your mental health. So these are brain healthy choices, and I recommend you to follow these choices to increase your brain health and reduce dementia. Now, where should I start? Well, start with an action plan. So try to pick a healthy choice of your choice, and start now. Make a goal, make a plan, and be realistic and specific, and start small. So pick a healthy choice every day or every week. Now, moving forward, I'll be talking about the aging brain, and we know that the brain ages like the rest of the body. We have more experience and wisdom. We can learn and adapt to new things at any age, but there's some changes in memory and concentration and thinking that we have experienced. So this is something that we know, right? Now, I'll be talking about dementia. I know you heard about this term before. So dementia is a result, is a condition. It's a consequence of different brain diseases. And mainly dementia is a group of symptoms that will affect your independence. And it's like a chronic disease. Symptoms can differ. Unfortunately, there's not a cure these days, but we know we can prevent. And not one size fits all. So everybody is different. So to explain dementia, the best way is the umbrella term. So dementia is like an umbrella, as you can see in the picture. So dementia is a consequence, the result of many conditions or brain diseases. And the most common one is under the umbrella is the Alzheimer's disease, as you can see on the slide. So Alzheimer's is mostly 80% of the cases of dementia. So it's Alzheimer's disease is the buildup of proteins like tau protein and tangles that affect the brain, and that can cause dementia. So Alzheimer's disease is the most common cause of dementia. But we also have other type of dementia like frontotemporal dementia. We have Parkinson's disease dementia, vascular dementia, which are related to stroke, dementia with Lewy body. So those are type of dementia under the umbrella. But dementia is the result of the consequence of different conditions, of different brain diseases that can affect and produce dementia. So as I mentioned, Alzheimer's is not necessarily the same as dementia. Alzheimer's disease is the accumulation of plaques and tangles, the brain condition and the brain disease where plaques and tangles produce dementia. And dementia is the group of symptoms that include memory problems, but it will take your independence away pretty much. So this is something to be something that we need to understand. So I have another thing to discuss is that dementia can affect not only your memory, as I mentioned, but also it can affect thinking, judgment, learning, speaking and listening, orientation, and understanding. So dementia can affect many cognitive domains, and it's not only about memory. But I have a good news for you, but because dementia is not normal aging. So dementia is not the same as normal aging, and this is very important. So we can start preventing and doing things to improve our brain health and prevent dementia anytime. Now, moving forward, we have 10 warning signs of dementia. So I will introduce you to the 10 warning signs. I'm gonna also share with you a sheet where when you can have this for your, you can put it on your, as the brain healthy choices, you can have it at your fridge, for example, or you can have a copy of it. To remember 10 warning signs of dementia. So 10 warning signs of dementia. People think that dementia, it's only about memory problems, but you can also experience some other symptoms like misplacing items, challenges with performing familiar tasks, confusion about time and space, challenges with language, challenges with abstract thinking, loss of initiative, for example, is very common in Alzheimer's disease, and we sometimes um, we don't um, we don't know this. Changes in judgment, changes in mood or behavior. So these 10 warning signs are possible or are could be a sign of dementia. It's not only about memory problem. Okay, so it's something. If we have these early signs addressed, and we can do a better job trying to get some help. So it's very important to tell you that 10 warning signs of dementia, and dementia is not only about memory loss. Now, if you have any thinking or memory or behavioral problem, you can talk to your doctor. So ask your doctor. Your family physician will be the first point, the first connection, your family doctor. So you can discuss if you're experiencing these warning signs. In summary, we have brain healthy choices that I just introduced you, so they can make a difference, make a plan. The brain ages like the rest of the body. Dementia is not normal part of aging, and see your doctor for changes in memory, thinking, or behavior, and please follow the brain healthy choices that I just recommended to you. Take care of your heart, stay active, eat healthy, be social, challenge your brain, protect your head, sleep well, and take care of your mental health. Now, how can you connect with the Dementia Society? So I will explain you a little bit of the Dementia Society. The Dementia Society these days is working remotely. We offer all of our services, and I'm really glad and proud to say this. We've been working so hard to get everything online for the clients. We provide education. We have support groups. We have social and recreational programs, system navigation. We have dementia care coaches. We have a lot of services provided to the community, and it's a free service. You just need to connect with us. You don't need a referral. If you have someone who is living with dementia in your family or a friend, or you're a caregiver, or you're experiencing some isolation or mental health problems, you can connect with us. We are a nonprofit organization that we also connected with many partners in the community, and we provide support and system navigation as well. So education, support groups, and social recreational programs are online and are virtual for everyone. So please connect with us. Now, if you need a dementia care coach, dementia care coaches are staff from the Dementia Society who can provide you with one-to-one support and help caregivers of person with dementia and their families by providing information, system navigation, and supporting strategies to self-management. So it's very important to connect with a dementia care coach. So this service is free, and you can connect with us. Now, we have a few programs that I'm going to tell you. We have a few virtual programs now. We have music, we have arts, we have exercise. You can register for them. They're all free, and they're in different schedules, so you can follow our website and register for our weekly roundup to get all the activities that we offer. For example, this one is a live concert that we have online, and we're going to have one every month until March. We had already one session for the whole summer, so we're now happy to say that we're going to have these sessions until March. And it's a monthly concert, so you can get free concert online. And this is the one that is coming up next week. It's October 27 at 4 p.m. It's with Chris White, and we are also partnered with Carefor. So Living Room Live concert series is very popular, and it's a great way if you love music. You can stay connected and watch listen to your favorite tunes. So this is an example of music programs that we have. We have a few of them, but as I mentioned, you can connect with me or with the Dementia Society if you want to learn more. Spark or Rayon Dart or Rayon Dart. These are very interesting programs that we have in partnership with the National Gallery of Canada. So basically, you will take a tour, a specialized tour through an art piece from the gallery. And we have a monthly Spark or Rayon d'Art, and they're taking place next week, actually, on Wednesday, October 28th, and it's at 1 p.m. So you can register for this one in October, but you can register also for November or December. So these are free specialized tour for people with dementia, and there are pieces from the gallery, the National Gallery of Canada. We have an art class online. It's called The Masterpiece. We have also Arts and Minds online. We have two classes, different type of classes, but this one it's in partnership with Careford. It's a Masterpiece, and it's taking also as an online art class offered for people with dementia and the loved one. So you can join. We have a monthly session, and they're for free. You can also get your canvas. You can get your supplies for the class, and it's pretty cool. It's very popular these days, and I really recommend you, if you like arts, please follow the art programs. Now, these days we also offering an amazing program that is offered by the Dementia Society, and it's called Take a Break, Make a Connection. So it's a virtual online sort of like respite idea for the caregiver and people with dementia. So you can stay connected, you can make a connection, so we can match you with a volunteer and with our Dementia Society staff, so you can stay connected with us and break isolation. So Take a Break, Make a Connection program is an amazing program that is starting, and we offering it in many languages as well. So we're very pleased we just launched this program a couple of weeks ago, and it's growing. So if you need to connect with someone, if you need to have a virtual friend and talk to someone, this is the right place to start with. And also, if you're a caregiver or someone with dementia who needs like sort of like a break, is a good way also to connect with us. So Take a Break, Make a Connection program. It's a very good program. Now you can stay connected with us as well. You can register to our weekly run-up. Is a guide for meaningful activities and brain health activities that we offer in the community. So you go to our website, it's dementiahelp.ca. I'm going to be telling you that later, the dementiahelp.ca website, but you can go to the website, and then you're going to see register to our weekly run-up, and you can get the weekly activities that we have for the week. And as well, you can also subscribe to our YouTube channel, so you can get on-demand videos of many things that we offer on demand as well. So you can join the Dementia Society weekly roundup or subscribe to the YouTube channel. Now, if you have also concerns about thinking, memory, behavior, you're isolated in the community, you're feeling that you need to talk to someone, you're taking care of someone with dementia, you don't need a referral. So you can reach out to the Dementia Society. We are here to help. The Dementia Society website, as I mentioned, is dementiahelp.ca. As you can see, dementiahelp.ca. The phone number, it's 613-523-4004. And the email address is info@disorg.org. So these are our contacts, so you can stay connected, connect with us. You don't need a referral. If you're also taking care of someone with dementia, we're here to help. And we provide education, support groups, and social and recreational online programs as well. If you need more information about healthy living, contact the Ottawa Public Health. I know this Ottawa Public Health website is so rich in information about mental health these days, and also COVID-19 situation. So if you need to reach them out, these are the contacts. You can go to the website. They are a very, very good website, and it's always updating information. So with this, I finished my presentation today. So thank you for watching this video, Mind Your Brain Health presentation, hosted by the Dementia Society of Ottawa and Brantford County in partnership with Ottawa Public Health. So thank you very much again to the First Unitarian Congregation of Ottawa, and thank you for watching this video. And if you have any question, I will be next Sunday to answer those questions regarding dementia. Hopefully, I'll be able to help you and guide you through the whole process. Have a good day, everyone.